medical field is transforming with several ways of treatments. However, homeopathy maintains its importance and effectiveness. Unique features like targeting the root cause of disease with providing complete cure for the patient is something that has been the reason of homeopathy's popularity even today. Due to increasing awareness, a large number of patients are opting for homeopathy, from the common man to the elite class. Experts of homeopathy, on the basis of their research and meticulous and sincere efforts to help patients get remedy, are not only finding solutions for several serious chronic diseases and helping patients live a normal and healthy life, but also creating large-scale public awareness about this treatment. Dr. Vijay Kumar Mane, one of the most reputed homeopathy practitioners of the world and the founder and CEO of modern homeopathy, has been practicing for more than 2 decades and has been successfully curing numerous patients with serious and chronic diseases through his extensive research and innovative treatment methods. He is also helping patients to regain self-confidence and live a happy and healthy life. Dr. Vijay Kumar Mane started his medical career as a lecturer and did extensive researches on traditional treatment therapy and invented simple curative line of treatment named modern homeopathy for several incurable diseases and gave relief to numerous patients. His journey began around 1998 from Kolhapur, and steadily it spread to other parts of Maharashtra as well. Soon, patients from other states of India as well as patients from around the world started visiting him and consulting him for his treatment. No doubt, his innovative ways soon proved beneficiary for the patients. Modern homeopathy's curative line of treatment has come into existence through thorough research, vast experience, and a huge database of successful case histories of patients of Dr. Vijay Kumar Mane. His continuous efforts to excel and steadfast research for further innovations, searching solutions for the patients with the most complicated symptoms have been the reason for his success. Dr. Mane is continuously working towards inventing new, effective treatments and innovative medicines of various serious and pathologically advanced diseases like cancer, kidney failure, liver cirrhosis, diabetes, asthma, arthritis, and other incurable diseases. Modern homeopathy is also designed to manufacture and produce medicines formulated and innovated by Dr. Mane. Medicines which are found both in liquid form and in globules and are easily consumable and highly result-oriented.
Hello, I'm Dr. Mrunmayee and welcome to your favorite health series, Healthy Era with Modern Homeopathy. As we all know, liver is an important organ of our body. We call it vital organ. And today we are going to talk about liver cirrhosis. Is liver cirrhosis curable? Is there any treatment for liver cirrhosis? Can modern homeopathy help in liver cirrhosis? Let us talk about all these things, and I'm glad today we have CEO of modern homeopathy, Dr. Vijay Kumar Mane with us. Hello sir, welcome to the show.
Hi.
So we will be talking about liver cirrhosis, but before that I would like to know the importance of liver in our body.
Liver is a vital organ, as we all know. It is situated in right hypochondriac region of our body, in abdomen. It is near about 1.5 kilogram in weight and divided into 2 lobes, right and left lobe, and further divided into segments. As we know, it is a vital organ. So liver has many functions which are vital to our body.
So what are those functions?
Liver produces albumin and other proteins. It also produces blood clotting factors.
Okay.
Liver also produces bile. The bile is important for metabolism of fat. Liver also detoxifies some toxins produced in the body, as liver works as detoxification organ for detoxification. It can excrete the toxins from the body into bloodstream, and kidneys removes out from the body.
When we say liver cirrhosis, what is liver cirrhosis exactly?
Liver cirrhosis means replacement of normal liver tissue by the scar tissue. The scar tissue can leads to fibrosis, and fibrosis leads to liver cirrhosis. So before fibrosis, there is necrosis of liver cells that can lead to liver fibrosis.
But what are the causes of this liver cirrhosis?
After fibrosis, there is a formation of nodules in the liver, that is called as liver cirrhosis. The causes are many more. Most common cause in India is chronic alcoholism. Repeated consumption of alcohol with heavy doses of alcohol can cause liver cirrhosis. There are many other causes of liver cirrhosis, like some viruses that can cause liver cirrhosis, just like repeated HAV infection, means hepatitis A virus infection, hepatitis B virus infection, hepatitis C virus infection, hepatitis D or hepatitis E, that can cause liver cirrhosis. Some other viruses like brucellosis is the also causative factor of liver cirrhosis. Some drugs like isoniazid and methotrexate, repeated intake of painkiller also may be a causative factor of liver cirrhosis.
Okay.
Crocin is the most common drug for as an antibiotic agent. So that can be a causative factor in liver cirrhosis.
Then how do we know that it is a cirrhosis? What are the signs and symptoms?
At early stage, the signs and symptoms are very vague.
Okay.
Just like loss of appetite, nausea, vomiting, itching of body, slight weight loss.
Okay.
But when there will be full blown picture of liver cirrhosis, when the cirrhosis develops at its extent, then the signs and symptoms should be swelling over all over the body, or swelling of legs and arms and face, swelling of abdomen when the ascites develops, yellow discoloration of the body, in later stages black discoloration of the body, itching all over the body. These are the signs and symptoms of liver cirrhosis. Occasionally or sometimes vomiting of blood and also blood in stool.
Oh.
These are the signs and symptoms of liver cirrhosis. We can diagnose liver cirrhosis with the help of some imaging tests like sonography of liver and few blood tests like CBC, liver function test, renal function test, that can diagnose liver cirrhosis. In CBC, hemoglobin diminished.
Okay.
Then platelet counts is also diminished in later stages of liver cirrhosis. LFTs will be deranged, means bilirubin will be high, or SGOT, SGPT deranged, and alkaline phosphatase also they get deranged.
Initially, there are all the signs and symptoms are very vague.
Yes.
So, if it is not diagnosed in proper time, then are there any complications which can be developed?
Yes, complications are much more common. If anyone suspect about liver cirrhosis, if any patient come with us which have history of chronic alcoholism, then he should undergo pathological test and imaging test. One thing I forgot to mention, when there is full blown liver cirrhosis, that means 80% liver is cirrhosed.
Oh.
At that case, the fibroscan of liver is also shows that the liver is cirrhosed in various extents. So that is also a very important test. The complications include blood in stool or vomiting of blood. So pleural effusion and ascites is also a deadly complication. It can lead towards death. Or jaundice, if bilirubin is more than 25, then it is dangerous, or it can lead towards death.
Yes, I think maybe because of this, it is very difficult to treat and to cure liver cirrhosis because it cannot be diagnosed in very early stage. What can we do about liver cirrhosis with modern homeopathy? We will talk about it right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. Mrs. Chandrabhaga Sawant, a patient who was diagnosed with liver cirrhosis, opted for the treatment of modern homeopathy. Let's see her reports and what she says about it.
Mrs. Chandrabhaga Sawant, aged 60 years, resident of Satara, Maharashtra, started with the following symptoms of anorexia, body ache, etc.
मला अजिबात भूक लागत नव्हती. जेवायची इच्छाच होत नव्हती. झोप खूप यायची. जेवण बघितलं की उलटी यायची. हातपाय खूप दुखायचे, झोप खूप यायची. सारखं झोपून राहावंसं वाटायचं.
Over a period of time, her complaints started increasing. She started taking treatments from other doctors, but had little relief. She soon visited a gastrologist and took treatment from him, which resulted in no relief as well.
गावठी असताना काही फरक पडला नाही. त्याच्यानंतर आम्ही फॅमिली डॉक्टरांच्याकडं 3-4 महिने सलग औषधं चालू केली काय वेळेवरची, तरी पण कसलाच फरक वाटला नाही. जेवण तर अजिबात जात नव्हतं.
There, she had some investigations done which are as follows. In August 2018, showing total bilirubin 14.68, direct bilirubin 12.88 and SGOT 126.
ज्यावेळेला पोटाची सोनोग्राफी ती जूनमध्ये केली त्यावेळेला असं लक्षात आलं लिव्हरला काहीतरी गडबड आहे आणि त्यामुळं आईचा अशक्तपणा वाढत चालला आहे आणि ते आजारी पडत चालले.
She was diagnosed with liver cirrhosis. Later on, her complaints also started increasing and started developing ascites.
साताऱ्यातील नामांकित पोटविकार तज्ज्ञांना आईला दाखवल्यानंतर त्यांनी त्याची केस स्टडी केल्यानंतर त्यांनाही जाणवलं की लिव्हरमध्ये काहीतरी प्रॉब्लेम झालेला आहे आणि त्याच्यावर त्यांनी उपचार चालू केले. उपचार सुरू राहिले परंतु आजार काही बरा झाला नाही, उलटा तो वाढत गेला.
Later on, it was informed that her liver was damaged for about 80 to 90% and was advised that her liver transplant was the need of the hour.
मला समजलं की लिव्हर डॅमेज करणारा लिव्हर सिरोसिस नावाचा एक भयंकर आजार आता आमच्या आईला झालेला आहे आणि त्यातून फक्त लिव्हर बदलणे किंवा लिव्हर ट्रान्सप्लांट करणे हा एकमेव उपाय असू शकतो.
Looking at the patient's age, her family opted not to go for surgery. However, her condition continued to deteriorate and it seemed there was little hope for the patient. At this point, her family became aware of the treatment provided by modern homeopathy and thus approached modern homeopathy.
मॉडर्न होमिओपॅथीचं मेन ऑफिस गाठलं. त्या ठिकाणी आम्हाला डॉक्टर विजयकुमार मानेंनी आमची केस पाहिली, सर्व रिपोर्ट पाहिले.
This in fact turned out to be the ray of hope for them. They started with the treatment of modern homeopathy and in last week of August 2018, within 8 days, her bilirubin got reduced from 14.68 to 12.75.
जे रिपोर्ट चिंतादायक होते, बिलिरुबिन वाढत होतं, लिव्हर फंक्शन टेस्ट ज्या धोकादायक वाटत होत्या ते सर्व रिपोर्ट आता मायनसकडं किंवा कमी कमी व्हायला लागलेले होते.
Other persisting symptoms also reduced. Her complaints of ascites also reduced.
पहिली गोष्ट म्हणजे तिला भूक लागायला लागली. भूक लागल्यानंतर तिला स्वतःहून चालायला येऊ लागलं.
And after a month of the treatment, her bilirubin reduced up to 5.59. She started feeling better, her health improved.
आता मी पूर्णपणे पहिल्यासारखी चालू शकते, हिंडू फिरू शकते.
And in October 2018, her bilirubin got reduced up to 0.53. Mrs. Sawant had no complaints later on and there was no need for liver transplant.
मॉडर्न होमिओपॅथील जे औषधं या ठिकाणी आपण घेतो ते औषधं इतकी घेण्यासाठी सोपी आहेत की त्यासाठी रुग्णाला दुसऱ्या कोणाची मदत लागत नाही. स्वतः रुग्ण स्वतःची औषधं स्वतः घेऊ शकतो.
Modern homeopathy's treatment has given a new life to Mrs. Chandrabhaga Sawant. She's back into her life, leading a happy and peaceful life with her friends and family once again.
Mrs. Chandrabhaga Sawant was tremendously benefited with the treatment of modern homeopathy. We will know in detail about this case right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. In last segment, we saw experience of Mrs. Chandrabhaga Sawant. And we are really keen to know more about this case in details from Dr. Vijay Kumar Mane. So we are really curious to know about this case because cirrhosis is considered to be incurable and this patient has got tremendous results in cirrhosis.
Patient came to meet me in August 2018. I saw her reports and assured to cure her without any transplant.
Okay.
She started with modern homeopathic treatment immediately. Before coming, her bilirubin level was 14.6. With just 8 days of our modern homeopathic treatment, her bilirubin levels came down to 12.75.
Okay.
Within 15 days of treatment, patient started noticing changes in her symptoms. Her appetite was normal. Symptoms started getting better day by day. All her symptoms like yellowness of skin and ascites was gone. The speech becomes normal. She continued with our treatment and her bilirubin level kept on falling down.
Okay.
In October 2018, bilirubin level was 2.15.
Great.
April 2019, her bilirubin was 0.53, which is normal. Patient is able to do all the work and is living happy, healthy and normal life with our treatment.
So when we say cirrhosis, are there any preventive measures we can take to avoid cirrhosis?
In India, more patients get cirrhosis from alcohol consumption. So patients or common people should avoid consumption of alcohol and tobacco.
Okay.
People should avoid consumption of painkillers and drugs like isoniazid and methotrexate. That is very important.
So there are few things which can be totally prevented, but if one is diagnosed with liver cirrhosis, then right now what is the conventional way to treat liver cirrhosis?
Conventionally, there is no treatment available for cure of the disease. With allopathic treatment, the disease is incurable. They treat the patient symptomatically. If there is ascites, then they can remove the ascitic fluid from the body. If there is pleural effusion, they can remove the pleural. They can do pleural tapping. If there, they can give laxatives and diuretics for swelling all over the body. They can give laxative for constipation. They can do banding for esophageal varices for oral bleeding or banding for hemorrhoids.
Okay.
These treatments are symptomatic treatment. They can give the symptomatic relief to the patient, not cure.
So in modern homeopathy, like the patient had come, Mrs. Chandrabhaga Sawant.
Yes.
So if a patient comes to modern homeopathy, then what is a way of treatment?
Our treatment is totally OPD based treatment. The patient can take the medicines at his or her home. 90% time there is no need to hospitalization. If patient is having severe bleeding through anus or stool or vomiting of blood, then she can manage in hospital with esophageal variceal banding.
Okay.
Otherwise, there is no need to hospitalize the patient. We can treat the patient at his or her home with our medicines, which can take the patient orally.
Okay, so there must be difference in costing also, because as you say there is no hospitalization required in modern homeopathy.
Yes.
How would you differentiate between these two
Usually,
treatments?
patient of liver cirrhosis needs hospitalization with admission in ICU or ICCU. Then we can avoid with our treatment. That's because our treatment is based on our theme that pathology is reversible under our modern homeopathic regime. So the patient cannot need the hospitalization. So the treatment cost get lesser day by day as the patient taking the treatment in her or his home.
The patient is advised for liver transplant,
Yes.
which is basically a very difficult procedure. It is very difficult to get liver, and in future also there are many complications of transplant.
Yes, transplant is too much costly. In India, it costs near about 35 to 50 lakhs rupees. And post-transplant cost is also too much high, near about 1 lakh rupees for immunosuppressant drugs.
Okay.
So, with help of modern homeopathic treatment, as we can see in this Sawant patient's case, that there is no need of liver transplant or no need of conventional treatment.
Right. Are there any things to do or things to avoid while taking treatment of modern homeopathy?
Yes, diet should be essential. Diet must be included. Diet should be low sodium diet.
Okay.
That means she should have take Sindhav salt, that is black salt, in in grams, 2 to 3 grams per day.
Okay, 2 to 3 grams only.
Per day only. If there is ascites, then she should follow other dietary restrictions also. That means the diet should be low oil, then low water consumption should be less if there is ascites. She or he should have avoid meat and chicken.
Okay.
But protein is lot more needed because protein loss is there and formation of protein or synthesis of protein is very low in the case of liver cirrhosis. So she should have to take extra protein intake like eggs and protein powder, etc.
So we are really thankful to you for being here, because liver cirrhosis is generally considered incurable, and we actually saw the patient, we actually saw the reports of the patient, and we are really convinced now that modern homeopathy can treat cirrhosis.
treat and cure cirrhosis.
Treat and cure cirrhosis. Yes. Thank you so much, sir, once again for being here. And if you have any queries about liver cirrhosis or you want to know more about modern homeopathy, then you can call on the numbers which are seen on your screen. So here we take leave for today. Goodbye and take care.
Our address, Modern Homeopathy Research and Treatment Center, E Ward near Gita Temple, Kawalanaka, Kolhapur 416003. For counseling and guidance, contact at our centers below: Kolhapur, Dadar, Kalwa, Thane, Dhankawadi, Pune, Pimpri, Chinswar, Nashik, Aurangabad, Nagpur, Solapur, Goa, Madgaon and Mafsa, Karnataka, Bangalore and Hubli, Telangana, Hyderabad. For counseling and guidance, give missed call at 70388-33881. You can also contact us on 9730339009 or at 9372728009. Our toll-free number is 1800-121-8009. Our website www.modernhomeopathy.com. You can also email us at contact@modernhomeopathy.com.